Hello everyone, this is NAINAMD, Fusion of Science and Beauty. Welcome to my show, and today's show is a stunner because I've got a stunning doctor here. He's from Beverly Hills, Dr. Randal Haworth, and we're right next door and does amazing things. And I thank you so much for coming on my show.
Oh, it's a true honor. Thank you very much, Dr. Naina.
The reason I wanted to bring you on is because you are doing things that really very few plastic surgeons are doing. We know that plastic surgery is an art as well. So the combination of keeping up on the cutting edge, keeping up on the new techniques, mixing it with the artistic sense, and then on top of that, being good in technique. That's an amazing combination to have. And I think you've got it. So I just want you to educate the consumers, the audience, on really what are the, plastic surgery has been a field. Women have gone for facelifts since, so many years ago.
Yeah,
I think
since
it's what,
the
over
turn
50,
of,
exactly.
well, actually, since the Lexer was a female surgeon who was at the turn of the last century in 1901, who did the first facelift in Paris, the first described facelift.
First described facelift, right?
Yeah.
So it's been around for a long time. Obviously, things have changed.
Yeah.
Tell me what is the newest in the techniques that you had to adopt to, and what are certain shifts in the thinking that is happening for the facial, in terms of the facial, surgery and some of the facial rejuvenation things that we're doing. And that's aside from the fillers, aside from the Botox. What is some of the surgical techniques?
Well, it's interesting because I think what's a seismic shift. I've even told patients of mine. I said back in 2004 and 5 and 6, I would be focusing on making people pretty, just like with the nose. It's like, oh, I felt good. I made the nose pretty. But after it healed and the swelling came down, 30% of them weren't as natural as I'd like. And I remember when we were in the Middle East together and so on, I learned a lot from there too, and I'd see them a year later.
Because in the Mideast, by the time they're 17, 18, everyone's having so many of their just rhinoplasties.
Right, they're following Beverly Hills now.
That's right, that's right.
So what's happened though is that there's a subtle but definite shift on making things look natural. I know we hear that all the time, but it really, you have to make people look like they've been genetically blessed with these results, and that it looks effortless. So when I tell people, for example, with a nose, you're making the nose pretty, but my noses take longer, or my rhinoplasties take longer than they used to, because now I'm erasing all evidence that anything was done. So I make it look pretty, and then like a crime scene, I hate to say it, we erase all the evidence and control the shadows and the highlights with crushed cartilage, etc. The ear,
kind of the holistic.
brow.
You have to be holistic about the face. In other words, what I do with balancing all of the hormones, the nutrients, all of that, you have to do that for the face. So you have to know a little about everything.
Resonance and dissonance.
Yes.
And you have to look at that. And detail. Yeah, the devil's in the details. So like the lips, for example. You can do a beautiful facelift, etc., but the lips are like the hands. They sag. And so this is what I became very well known for, excuse me, were upper lip lifts, corner lip lifts, lower VYs, and I've learned a lot from painting. I've had 4 art shows and galleries, solo shows, and I learned that the power of a single shadow will change. Look at the Mona Lisa, that enigmatic smile. Is she smiling or is she grinning? Does she know something more than we don't? It's all in the shadow. And so it's the same thing when you're looking at the lips.
It could be just that one tiny thing that you do that just
it just changes, and it's all about the harmony, taking the one dissonant aspect in the orchestra, and I'm the conductor, and then bringing it in, and suddenly it resonates. And so that's what I like doing.
And I think that's really why I had you come on the show, because so many people just say, okay, I'm just going to go to a plastic surgeon, and then they shop for the best deal. It's not about the best deal. It's about what result you're going to get, and for X amount of money, this is your entire life. Okay, I would rather give up dinners for 3 years to be able to, if I was going to do something, to do it the right way. I think that's what and NAINAMD, the whole idea of the show is to set the awareness, number one, that anti-aging and regenerative medicine is a credible field. We have now so much evidence-based medicine behind it. So it's to take it out of that, so to speak, that misperception phase, but also to bring on, you know, amazing people, doctors, and people that are connected with making people look beautiful from the inside out, but having that top 5% globally, those standards. And I think you absolutely fit those standards. And paying attention to detail is what I really was. You know, I've been trying to get you on my show for like, now it's like the 12th show down or something.
Boy.
But I know you've been in surgery all the time. Thank you so much.
You.
But it's but that was the whole idea. I think it's so important to emphasize the detail that you have to put.
Well, one of the things also, we're talking about holistic way of looking physically at the face, but the other thing, Naina, is to look holistically at the whole soul. I know it sounds cheesy or whatever, but it's really, really true. Because plastic surgery can make a happy person happier, but you can't make an unhappy person happy. So if they are coming in with, and they're disgruntled, or they have a bad marriage, or they're just unhappy, I'm the wrong office, and it's important for me, and I use my staff because my girls are actually better at this than me. Maybe it's a feminine to feminine energy, even though, you know, we have 20% males, but they're very good at spotting the red flags. And we spot the red flags not to protect me, which is also true, but also to protect the patient from themselves. Because if they are going to have surgery for the wrong reason, even if I do a beautiful job, they are going to be unhappy, and then they are going to be dissatisfied. I've created more angst in them. And remember the Hippocratic oath of this physician, first do no harm. I've actually done harm to these people because I've created more angst and more anger. And actually it's done harm to me too, because we don't want unhappy patients.
I think patient selection is so important, right? Having said that, selecting the patient. And so many women, and that's where I sort of, you know, parallel with you at times, is women who are sometimes very frustrated and may have a bad, they don't understand that sometimes internal imbalances, right? It could be that they're just in that menopause where some of their key hormones have declined to where it's making them imbalanced, so that if we balance that part, then if they go for a surgical result, it's going to be nothing but positive experience for them. So much of it is I think a team effort where people don't realize those things, and you look at that. That's what I love. It's not like you're just doing a plastic surgery where it's like, you know what, here's a deal, come in, come out, you know, 3 days this, 3 days that. Again, there is personalized medicine, and there's non-personalized medicine, standard of care. There's standard of care, so to speak, plastic surgery, and there's personalized plastic surgery. You're doing that personalized plastic surgery.
Thank you. And what do you find is the most common treatment? I know it sounds so vague for women that come to you.
For the,
you know, let's say a woman who's 45 and
the main things that I see that come to me is that they're saying they're fatigued, but that they feel like their face is sagging, that they're looking old. Okay, and this is usually the woman that's in the perimenopause so she's just feeling old, looking old. Suddenly things that her muscle tone that she normally had, she could exercise and get in tone or go on a diet, she can't do it anymore. She's wondering why she's losing that in physics.
Even though she's exercising.
Even though she's exercising and so forth. So a lot of that has to do with the number one biomarker of aging is loss of muscle mass, sarcopenia. People don't quite understand. They think it could be blood pressure or other markers of aging. Number one is sarcopenia, loss of muscle mass. And a woman past the age of 40 is losing about 0.4 pounds of muscle mass a year, whether she exercises, likes it or not. So now she's asking those questions. How come I can exercise and I'm still not being able to get that tone? And do I need to go to a plastic surgeon? And so what I do is I say, okay, I'm sending you, but let me balance the hormones, because that's going to impact her collagen production, her elastin production, her all of the other things that she needs. Now she might be a little bit more calmer, a little bit happier. There's
and what do you do, like to stop or?
It depends. Again, it's so personalized. Sometimes I don't even do a bioidentical hormone. Sometimes I just do a nutraceutical regimen, or sometimes I just figure out their micronutrient deficiencies, or sometimes a simple thing as a B12 bioavailable form will set her neurotransmitters going and make her make her balanced.
You know, you're making me, I need to go work out after this. Get my muscle mass going.
So basically, I think the same thing with the detail in the plastic surgery. I really think women, those and men, those of you who are considering plastic surgery, please look at the reasons why you're going for the surgery, treat your imbalances internally, and then when you're coming to the plastic surgeon, you know, get a plastic surgeon that's going to look at you with everything, rather than what it is what they want, but also you're going to give them input on what you're seeing and where's the artistry in plastic surgery working at. I think that synergy needs to be there.
It's very well said, by the way.
Well,
and
yeah.
The one thing I always say to the patients, though, is, you know, when I first meet them, I'm just your waiter.
Yeah.
You know, you pay me for the consult. I'm here to give you information.
Yeah.
What I say is not necessarily right. There's no right or wrong. You're just, you know, it's in my opinion. So sometimes we catch ourselves saying, oh, you need this or you need that.
It's
and
our
then
opinions.
you don't need that.
Yeah.
It's not cancer surgery.
Yeah.
You just need, you know, it's in my opinion, you benefit from. But, you know, I'm not going to, I ask permission first before I'd start talking carte blanche about their face. But I still ask permission before doing that, because remember, plastic surgery, we can abuse the power of suggestion. So I know plenty of patients that have come to me and they said, oh God, I had my nose done, and but I'm here for my jowls. And so they show me pictures of themselves from before, like when they were 20 and 25, and they said, look, at 28 I have my nose. I looked at it and I said, that's terrible. It's like, why did you get your nose done? Because your nose is really nice before. And they said, well, the surgeon said I could just lift up the tip or something like that. And I think that's an abuse of the power of suggestion. You create an insecurity now in the patient. They start resonating once they've heard that. Oh, your nose is not quite as good. And then they do something silly that they'll regret for the rest of their lives. So you have to...
So you're very particular. You're very particular, really, of how you communicate to the patient.
It's very true, and to allay their expectations, because I got a very bizarre job where we have to make healthy people temporarily unwell in order to make them look better. And that's a big responsibility. And, you know, you have to spend all that time and tell them. They come to me, they look at my website or whatever.
What is your website, by the way? If people want to, let's say, come to you, what is your website?
It's drhaworth.com. Here's a plug. DRHAWORTH. Oh, this one. drhaworth.com, which is DRHAWORTH.com. And we're located in the heart of Beverly Hills with Dr. Naina. And they...
in terms of when they come to you, and you're giving them the expectations, you're saying you're very realistic. Yeah, because what's important is to allay their expectations. So they come to me, and I tell them, I say, we can show you plenty of pretty pictures. You've seen them. That's why you've come here. But I say, what's really important is now I'm going to show you the ugly pictures. So let me show you what you're going to look like on day 2, day 5, day 10. Didn't you? Weren't you on the show? What is it? On the TV show? The Swan. The Swan. Yeah, that's what they had to do. Day 1, you have to go through that, right? Remember? Yeah. I know. Well, people forget. You know, it's very important to show them that, because the last thing you want is like day 5, and they're saying, "Oh, my incision, it looks keloid," and I said, "No, you just had the stitch removed." Yeah. You know, so it's a lot of education. Because you know what it is? You keep them calm, because it's like an airplane flight. So you just want to keep the patient calm, very collected, calm, composed. And give them the uglies pictures beforehand and let them know what they're going through. What their expectations are. So that's another thing you do. You really go through there. But you know, it takes time. So it's really, how are these plastic surgery centers that are just like getting people in and out? How do you function? Because that's not what you do. No, I'm not built that way, because there are certain surgeons. I've seen you. You spend sometimes hours with patients. Yeah. I've seen you where you're just. It's just all about that interaction. It doesn't matter. Time is inconsequential as long as that patient goes out with the best result, best education, and best expectations. Well, you have to be honest with yourself. And I've chosen this career, for better or for worse, but I've chosen this career. Because I'm passionate about it. I can't lie to myself. And there are plenty of used car salesmen out there that will sell you because that is their job. Yeah. Yeah. But my point is, I feel as an artist, and I approach it in a full. I immerse myself in the patient. Yeah.
and it's a journey that we
I
both
think
go
it's showing
together.
through. I think that's coming through in my talking to you today, and I think the audience is already sensing that because it's so you have looked at the patient in entirety, their psyche, their what you see in terms of physically, what their just synergy, their energy is, whether it's a nervous energy, whether it's not, and also then you bring everything into balance. Then you do your surgery, and I think that kind of balance will give the outcome of your results much better.
I think so. When they're calm and wherever is with the hormones and so on and so forth, when they've got balance, it's a patient that's a smoother ride. Because when you have a patient that's very, very nervous, it creates dissonance.
Thank you so much again. Thank you, everyone. I'll be right back with my next guest, NAINAMD, Fusion of Science and Beauty.